Hey everyone, my name is Heather Mahurin and I'm a current fourth year med student at the University of Washington, and I'm here to talk to you all about dermatology. So here's a little overview of the video presentation. We'll start out with a scope of practice of dermatology and then get into some reasons why I personally chose dermatology as a specialty to go into. And then we'll talk a little bit more about the specifics of what life would look like as a dermatologist. Next, we'll get into electives, both required and some suggested electives for applying into dermatology, as well as the timeline throughout your years of med school for preparing your application. We'll talk a little bit about letters of recommendation and then some tips on how to make yourself a competitive applicant, because unfortunately, dermatology is a pretty competitive specialty these days. And then we will discuss some fellowship opportunities for after you finish derm residency, and then end with some helpful resources. So I wanted to start out with an overview about the field of dermatology, and I got this definition from the Careers in Medicine website, and it says, dermatologists diagnose and treat pediatric and adult patients with benign and malignant disorders of the skin, mouth, external genitalia, hair, and nails. So as you can see, even though dermatology is considered one of the more subspecialty fields within medicine, there's still quite a variety of different conditions that dermatologists can see and treat. So some examples of those are, of course, skin cancers are a big one within dermatology, and that includes things like melanoma, squamous cell, basal cell, and then as well as atypical moles or other benign moles or tumors of the skin. And you'll see some pictures of these skin cancers on the right-hand side of the slide. Some other really common conditions are things like eczema, psoriasis, contact dermatitis, other allergic skin disorders. And then you'll also see a lot of different skin manifestations of both systemic and infectious diseases. And then educating your patients on things like skin cancer prevention and sun protection is a really big part of dermatology as well. Some treatment modalities that are frequently used are, of course, topical, so prescribing patients creams to put on their skin, but also dermatologists end up prescribing systemic therapies such as immunosuppressants, biologics, for patients that have more severe skin conditions. That can really make a big difference. And then in residency, you also get trained on different surgical techniques. So whether that's excision of skin cancers, you'll also spend some time learning Mohs surgery, which is a really cool tissue sparing excision technique where you're acting as both the surgeon and the pathologist. In the same day, you're looking at margins of the slide you take the day of the surgery, which is pretty unique and a pretty cool field. And then lastly, dermatologists also get special training in dermatopathology. So you learn a lot of pathology and histology and how to correlate that with what you're seeing on someone's skin. And then of course, cosmetics. Dermatologists can do procedures such as lasers, Botox, fillers, as well as other reconstructive things like flaps and grafts. So here are some reasons why I chose dermatology personally. Really, like I mentioned before, the breadth of the specialty I think is pretty amazing. So you'll see a really wide range of diseases ranging from common things like acne, psoriasis, rosacea, but then depending on where you're practicing, you might also see things like cutaneous lymphomas, autoimmune diseases, blistering skin conditions, infectious diseases, and a whole lot more. And then on top of that, you'll also be seeing a wide range of patients and patient populations. So you'll see, you can see infants, kids, all the way through teens, adults, and then geriatric patients. So it's really cool to have that really wide variety within a specialty. Then of course, dermatology can be a pretty fast-paced environment. On a standard clinic day, especially in private practices, you might be seeing upwards of like 30 to 40 patients a day. So you're always on your feet, always thinking about the next patient, and I really enjoy that pace. Working with your hands is another huge aspect of dermatology. You will end up doing a lot of in-office procedures, although you won't necessarily be in the OR very commonly. That's usually incorporated into your clinic days or doing things like excisions and other procedures on the skin. So that's a great component as well. And then really importantly for me too is helping patients with their quality of life. You know, your skin is really what you present to the world. And there's been multiple studies showing patients, especially with chronic skin conditions, how that can have a really huge impact on their quality of life. And then it's really great to be able to help make a difference for those patients. And then as a bonus too, patients tend to be really highly motivated to follow your treatment plans because people care a lot about their skin. So patients in general tend to be really appreciative of what you're doing for them. The longitudinal continuity is another great aspect. You'll be seeing patients with chronic skin conditions every few months to check how their treatment's going. And then when patients get skin cancers, you oftentimes will want to see them at least once a year to do a full skin check and make sure nothing new has developed. So that's really great, getting to see patients and their families over time. And then, of course, it's a really highly visual field. So not only are your eyes your main diagnostic tool by looking on someone's skin directly, there's also that really big connection with histology and learning how to correlate things under the microscope to what you're seeing on the skin. So I think that's a really cool connection as well. So some specifics about dermatology and the path to get there. It's a 4-year residency. So that first year is actually a separate intern year. So you'll either do a prelim year in either medicine or surgery, or a transitional year. And then you'll have 3 years of derm residency, so 4 years in total. There are some exceptions to that. There's some things like med derm combined residency, which are typically 5 years. And then if you're really interested in doing research in your practice, there's things like research tracks that are 2+2. So you'll do like some extra research at the end of your derm residency. And then dermatology tends to be a pretty small field. So most programs, I would say, have between like 3 to 5 residents per year. But of course, there's some exceptions. The really small programs have maybe 1 to 2 residents for each class, and the larger ones can have 7 or maybe more. The salary, once you're done with residency, can range, of course, depending on what area of the country you're living in, and of course, what setting. So academics tends to make a little less money than private practice, but that range for dermatology is somewhere between $315 to $450K per year. And your average week as an attending, most attendings work between like 40, 45 hours a week. And there's a lot of opportunities for things just beyond the clinical setting. So a lot of dermatologists will do things like research, teaching, of course, things like incorporating telederm into your practice. So there's a lot of ways to really tailor dermatology to what you're specifically interested in. So getting into some of the process of applying into dermatology, this slide talks about the different electives that you'll want to take to prepare for that. So the only quote-unquote required elective for derm is the dermatology APC in Seattle, and that's MEDEC 604 at UW. You have another option to do the pediatric dermatology elective, but you'll just want to keep in mind that that's actually not an APC, so you'll have to do another elective to satisfy that requirement. And whichever one you do, those are really important rotations to do in Seattle specifically, because that's where you'll get the chance to interact with the academic dermatologists that work there. And you'll want to get a letter of recommendation from someone in academics, at least one academic dermatologist. And we'll talk about that a little later on as well. And beyond that, everything is really suggested. That's the only strict requirement to apply into derm. But something that's pretty strongly recommended is doing at least 1, maybe 2 away rotations at different institutions. And that really shows that you can thrive and learn in a different institution than your own, which is, I think a lot of programs put a lot of weight on that. It can be a good way to make connections at other places other than UW. And then doing your sub-internship, you really can do in whatever field interests you. So I personally did mine in medicine. I did the hospitalist sub-I at UW, which I really enjoyed. But there's other options too. I had classmates that did a sub-I in oncology or plastic surgery. So whatever seems most interesting to you, you can do that. And then really beyond that, additional electives that might be most applicable to derm includes things like ENT, ID, rheumatology, because there's a lot of overlap with autoimmune conditions, especially in dermatology. Allergy is another great one, and then pathology. So really pretty flexible on those. I don't think programs are too picky about what other electives you want to take, but those might help prepare you for a future derm. All right, so let's get into the timeline of applying into dermatology. So this slide will focus on your first and second year before you start doing your required clerkships. And I think one important thing to mention is to really try to take the time to explore a lot of specialties during your first couple years, especially ones that aren't required in your core clerkships, because this might be one of the only times you get to get a glimpse into what those specialties are like. And then if you do that, maybe do some shadowing in derm and decide it's something you're interested in. Some good things to do can be to connect with the specialty career advisor at UW, and that's Dr. Very, and he can give you some general tips about what things to think about before applying into dermatology and how to prepare your application. The Derm Interest Group at UW is also a really great resource. They have actually a spreadsheet of research mentors, and so if you're trying to get involved in research, that can be a great thing to look into. And then they can also connect you with other things like volunteering and shadowing opportunities. So definitely getting on their email list is a great thing to do. And then really get involved in extracurriculars that interest you. Importantly, this does not have to be derm specific. So it can be whatever you want, things like community service, leadership. I was involved in UTest, which is a group that does free HIV testing because I was really interested in infectious disease. And also things like mentoring. So it doesn't have to be specific to derm, just do something that you're really passionate about and try and get really involved in a few things. And I think that'll serve you well when it comes time to apply to derm and talking about your experiences on the interview trail too. And then getting involved in research projects is pretty important. So as soon as you are thinking that you might be interested in derm, that's a great time to start getting involved because research can take longer than you might first anticipate, which I learned the hard way in the beginning of med school. And so trying to connect with a faculty member in derm and seeing what projects they have available is a great way to go. And then really taking some time to study for step one. At the time I'm recording this, step one has actually recently now is pass fail, which is different from when I took it. And so I think it might be easy to kind of spend your time doing other things, but I do think having a pretty solid foundation going into step one will not only help you as you go into your clerkships, it'll also help set you up to have a great foundation for step two, which I think programs are going to start placing a bigger emphasis on now that step two is still scored and step one isn't. So just something to think about to, not blow off step one studying too much. And then I did want to briefly talk about this slide. This is from the NRMP Charting Outcomes from 2021. And as you'll see, the bars for dermatology are pretty high. So the mean number of research items for matched students is 19 on average. And so not putting this number up to scare anyone, it definitely was intimidating to me when I was looking into dermatology. But something important to remember about this is it's not just publications, so you definitely don't need to have 19 published papers. This is including things like abstracts, presentations, which can add up pretty fast when you're doing a couple of research projects. And then also this, I think the mean is definitely influenced by other students that have gotten their PhD or doing an extra year for research. And so the advice I heard was really to try and get a couple of publications before you apply into derm. Beyond that, anything's great, but try not to stress yourself out too much by looking at these crazy numbers. So moving on to your third and fourth years of med school, of course, you'll do your core clerkships during your third year. And then really it's at the spring, at the end of your third year, that you'll want to do your derm APC, preferably in Seattle. And then the next thing to think about is the timing of your away rotations. And those typically happen between June through September at the very beginning of your fourth year. I will say that I actually did mine in October, right after submitting ERAS, and it still worked out pretty well. But I think if you're trying to get especially a letter of rec from your away rotations, doing them before that ERAS deadline in September will be preferable if you can. And the application portal for away rotations is called VSLO, and that opens in around February or March of your third year. So if you can, around January or February is a great time to start preparing some documents for that, like getting your immunization records all organized. Some programs want you to write a brief essay or submit a letter of rec. So just tracking those requirements and being ready to submit them as soon as possible will help set you up in a better place to get an away rotation. And then you'll want to take step 2. I think the UW usually has a deadline of June 30th for that. So really anytime in the spring or even early summer before that deadline, if you can set aside a few months of free time to dedicate to study to that, that's great. And then you'll take your sub-I as well as your elective sometime during 3rd or 4th year, whenever is best for your schedule. And then moving on to the application and interview season, something you'll want to prepare ahead of time is asking for letters of rec. And I think it's always best to ask during rotations if you can. If there's a faculty you really connected with or someone offers to write you a letter, that's really the best time because you'll still be really fresh in their minds, and then they can wait to actually submit the letter until ERAS is due. But I think asking for letters in July or August at the absolute latest is typically preferred. And then ERAS application, that will be due sometime in September. And then importantly for DERM, there's actually a supplemental application that was new starting last year. And this includes things like some short answers about your most meaningful experiences, and then preference signaling if you want to signal any specific DERM programs or even geographic regions. So those will be things to think about for the supplemental app. And then you'll submit your ERAS application in September, and then you'll wait like over a month and it'll be radio silence, and your friends will be hearing back from other specialties getting interview invites. So just try not to panic. DERM has a notoriously late interview season compared to other specialties. So there's actually 2 interview release days in November that most programs will release their interview invites during. So that's kind of nice to have a little bit of a timeline for when you might hear back. So try to just breathe and not freak out too much before then. And then interview season, like I said, is on the later side for DERM. It's usually December and January. But importantly, you'll also be applying to prelim and or TY programs, transitional year programs, and those interviews might be earlier, so sometimes October, November. What I personally did is I tried to do my prelim year interviews in December and then the bulk of my DERM interviews in January, and that gave me a nice little division. So people do it different ways, but just try to remember that you want to avoid those interview invites conflicting with each other in terms of the dates. And then you'll submit your rank list in February, and then match day is in March. So some more details about letters of rec specifically. You can submit 3 to 4 letters with your ERAS application, and importantly, those don't all have to be the same 3 to 4 letters for each program. You can actually mix and match your letters to different programs if you want. And really, you'll want at least 2 to 3 of these letters to be from dermatologists, and then 1 of those you'll want to be from an academic dermatologist. So that preferably would be someone like a department chair, program director, or APD. And then the other letters can be from your research mentor, maybe another clinician from a different specialty that you really clicked with. But really the bulk of your letters should be from dermatologists because that's the field that you're applying into. And then if you can ask for a letter during your away rotation, that's really preferable. Sometimes your away rotation doesn't really show up on your transcript in time. And so this is actually the main way that programs can even tell that you did an away rotation. So if you can get a letter from that, that's really great as well. Also for your prelim medicine programs, most of those actually require a Department of Medicine letter or a chair letter. That's the same thing. And so you'll reach out to someone in the medicine department around early summer. They'll help you fill out all the paperwork for that, and you'll briefly meet with an IM faculty and they'll get you that letter. You can use that same letter for transitional year programs as well. And then in terms of asking for a letter, like I was saying, I think July or August at the very latest, but as soon as you are working with that person and think you might ask them for a letter, that's a great time to do it as well. You can never really be too early. And then some things you'll want to provide your letter writers are your CV. So keeping that up to date throughout med school is a great thing to do. And then either your personal statement or just a draft of your personal statement if it's earlier on in the application cycle. And then once ERAS opens, you'll be able to create a letter request form for them. So including those 3 things will really help you get the strongest letter possible. Here are a few tips on ways to make yourself competitive, because DERM unfortunately does tend to be a pretty competitive specialty. So things like your clerkship grades, they do matter. I think trying to get the majority of your clerkship grades as honors is preferred, but don't feel pressured to try and get like every clerkship needing to be honors, because that's not always realistic. So just do the best that you can with those clerkships. And then research, like we talked about, is definitely important in dermatology. You'll want to get at least a couple pubs in derm before applying. And then something to consider too is taking a research year. So that's commonly done after your third year if you either don't have enough research, or maybe you decided on applying into derm later, or you have other weak spots in your application. That might be something to consider. Or some people even do this after graduation. So definitely talk to your advisor and get some opinions on whether a research year would be a good idea. It's not required, I'll say, but it can be pretty common within derm applicants. And then other extracurricular activities, really do what you're passionate about, try and get involved longitudinally over time. I think can show really great commitment to whatever you're really passionate about. And then now that step 1 is pass fail, I think greater emphasis will be placed on step 2 scores for dermatology, for better or for worse. And so trying to do as well as you can on step 2, I think will help you stand out. AOA or Gold Humanism membership are other awards that derm programs might look at more closely. And then away rotations, I think trying to be mindful about where you want to do your away rotations at. So one example of this is, like myself, I really have grown up mostly in Washington, so I got the advice to do an away rotation in a different part of the country, like the Midwest, to show that I'm really committed to moving wherever it takes to get into dermatology. So that might be a consideration. Or if you're really interested in a program but you don't have any connections there, doing an away rotation and getting to interact with the faculty in person can really help you stand out and allow you a greater chance at getting that interview invite. And then networking. So really, as soon as you know you're interested in derm, reach out to faculty, reach out to derm residents, see who you connect with and might share common interests with, and then stay in touch with them over the years and really try to develop that mentor-mentee relationship. I think having someone who really can advocate for you during application season can make a really big difference within dermatology. And then lastly, thinking about your story and your interests. So what in your story has led you to where you are? Of course, thinking about why dermatology, but I think even having some specific interests outside of derm or something that can be applied to dermatology can be great. So whether that's like advocacy or medical education, having something specific, I think, can show that you've really been thinking about it, and no one knows exactly where they're going to end up, but it's great to have some sort of path that you're thinking about to talk about in your application and on the interview trail as well. So briefly, here are some fellowship opportunities after you finish derm residency. So there's 3 ACGME accredited fellowships, and those are Germatopathology, Peds Derm, and then Mohs Micrographic Surgery. And then some other ones, there's also fellowships like Cosmetic Derm Surgery, Complex Med Derm, Cutaneous Oncology, and lots more. I've seen things like Clinician Educator Fellowships, Rheumatology Dermatology Fellowships. So there's a lot of ways to continue narrowing sort of what you like within derm even after residency. Here are a few helpful resources. I really like the specialty guide on the UW Medicine website. I'll put the link for it in the video below. And I used a lot of content from that for this presentation. So there's a lot of great details about what to think about during each stage of med school and how to prepare your application. So highly recommend that. And then there's also this group called DIGA, which is a national organization for derm interested students, and they have a lot of great volunteering, networking, and research opportunities that you can look at. And then I thought I would include some resources to use during your rotations as well. So the AAD has a really great curriculum about common derm conditions that you might see on your rotation. So that's a great one to look through. And then Visual DX is fantastic. As a UW student, we get a free subscription through the library website. So definitely check that out. It can help you not just on your derm rotation, but on your family medicine rotation, IM rotation. If you see a skin condition, that can be a great way to sort of think about differentials and even initial treatment plans. And then really lean on your advisors throughout this process. So Dr. Jay Very is the specialty career advisor for derm at UW, and he's a fantastic resource. So if you think you're interested, definitely reach out to him. And then the general career advising services as well. I've used during med school, and I think they're absolutely great for students. So thank you all so much for watching, and best of luck in your medical school journeys.